So again, good afternoon to everyone, BSN to one. We will hold our synchronous session in nursing informatics. But first and foremost, we'd like to have a review of the lesson that we discussed last time, and this will open a floor for everyone to have questions, clarifications, or even sharing of experiences of what you have learned during our initial discussion on the concepts of nursing informatics. Actually, we have discussed the basic concepts of nursing informatics last time, and we have already considered the terms that had been associated with nursing because we do have our interactive session last time. I think the terms that have transpired with our interactive session last time is all about in nursing, it's all about caring, and in the informatics, it's all about technology. So we try to link the principles of nursing as a caring profession and the use of informatics, its principle, the use of the technology. And nowadays, we have realized that the point of having our major roles as nurses is really very significant to to maximize because of some of the concerns that happened in the past 2 years. So we have also discussed last time the introduction on health informatics, on how we defined informatics as a science, data, information, and knowledge. So we have defined data as it has no specific meaning. The information has its meaning, and the knowledge has more broad translation of meaning. So later on, as we continue with our discussion, the topics that will give more emphasis and exploration on the explanation pertaining to data, information, and knowledge will be discussed in the succeeding topic. We have considered also the definition of the healthcare informatics, and I have shown already to you the audiovisual presentation last time, and it discussed about health informatics. One thing that are very common in the health informatics, it considered the computer science and the information science, the use of how the information had been processed, stored, accessed, retrieved is the process by which we can use this information for the healthcare management. So thus we considered po health informatics on the information and the technology. And we have considered this its benefit on the following: to communicate. So we have discussed last time that it is very important to for the healthcare team to communicate with each other. So through the health informatics, the healthcare team can have the real time communication even in the absence of one of the members of the healthcare team. And we have been very efficient in that management because it translated into the perspective of a real-time management of patient, prevention of complications, and prioritization during emergencies. The health informatics also considered the management of the knowledge because the access of the basic information is very relevant because, for example, uh, the results of diagnostic examination that can be accessed by all the healthcare team to facilitate the diagnosis of the patient, then that's management of knowledge. The source itself is managed and consolidated through an information system of the hospital. And even the patients themselves benefited from the healthcare informatics. If ever the patient would want to know the specific services of the hospital, they just need to visit the website of the hospital, or if they could upload, or rather download, rather not upload, download the applications of the hospital information system of the hospital, they can have the primary knowledge on the services, and possibly there could be also a way of how the patients can also retrieve information sources. In the mitigation of errors, healthcare informatics uh, could be helpful in such a way that it will prevent error because consistently the access of all the informations are very relevant for each healthcare team. For the nutritionist, for example, if she managed the diet of the client, then she need to know the history of the client. So to prevent the error in the preparation of diet of the client, she needs to review the history of allergy of the patient, and the present diagnosis of the patient, past hospitalization of the patient. This is definitely to mitigate error. So if this is also time efficient in such a way that the healthcare team may not anymore perform interviews, because the information itself can already provide and sufficient to have the efficient care management. Just the same as for the doctors. If the doctors will order a specific treatment regimen, the nurse can already manage the carrying out of orders, even though the doctor is not yet physically present during his rounds. So that's mitigation of errors. And if ever we will try to validate the drugs that have been given to the patients, it can be verified by the doctor if it was administered on time, or if there are adverse reactions that had been recorded on the uh, administration or the administered drugs or medications to the patients. And the healthcare informatics supports decision making. Even though during the time of the COVID, the decision making matters, even though on the remote way of managing exchange of information, the telemedicine, the teleconsultation supported the decision making among the patients and their relationship with the healthcare team. Other than that, the support of the healthcare informatics also helped the healthcare team to have the clinical decision making on the holistic approach to our patients. So these are according to QSN 2000P. We have also reviewed and discussed about health informatics as revolutionizing in caring and improving health. So actually, revolutionizing that the health informatics benefited individuals and population groups, or even the entire community. So we have mentioned, or you have already stated in our interactive sessions, that caring is very prominent in the nursing profession. And indeed, in revolutionizing it, it is a matter of adopting innovations. And the technology itself is the one that really helped the community. Although we are aware of, sabi nga, prevention is better than cure. That is very true on the perspective that if the patients themselves or even the authorized health personnel in the community can access to data, can access to the numbers, can really consider the prevention of the mitigation of the spread of any infection, or rather, it may prevent complications. So this revolutionizing is a matter of how you will maximize this technology, and it is better and how it will be relevant to our profession. That's why I even challenge all of you, if you will have your nursing course, or if you will already conceptualize your research, try to maximize or try to consider the use of technology and the profession on how it will help the people in the community, moreover in the public health, or moreover with those individuals in the community. We have discussed also the principles of computer in information science. The computer that we have discussed is the storage, the access, retrieval, the hardware, and the software. While the information science is on the perspective on how this information or how this data had been analyzed and translated into information and knowledge. And we've considered the four principles as we discussed last time. The advancement of life sciences research. This considered the evidence-based practice, clinical decision making. So when we try to consider the analysis of results, it may translate on a recommendation, and the results could be utilized for policy making, could improve the quality care management of nurses, and may also consider the patient satisfaction on the objective of each institution to render quality services. We have considered also the principle of health professions education, and one of the examples that we discussed last time is pertaining to the not just only in higher education institutions or nursing schools, but we considered also on how nurses have continue the continuing professional development, even though during the restrictions of face-to-face, they still continue to upgrade their skills and competencies through online trainings, through online webinars. So it did not considered as a barrier. And through the use of the computer in information science, this was made possible. And three, we have considered in the public health. So this is significant in a way that during those time of the pandemic, our example was the establishment of the uh, tracking device, because during those time that nurses are really oriented to do the contact tracing on a house to house mode, but the risk during those time is the scarcity of resources on how they will be protected. So that's why the tracking device had been developed for public health, so that it could already identify uh, uh, communities that could be high risk for the spread of disease, or it could already identify a specific area where individuals have already developed symptoms that is similar to a particular variant. That's why this really, the computer and information science and health informatics really help our communities, the local government units, the city health offices, and this also considered po during the time of the Department of Health when they do daily updates every 4 o'clock of the cases of COVID-19. So it utilized and maximized the use of the information system. Moreover, the patient care. In patient care, what benefited the use of health informatics for patient care is through the use of electronic health records, electronic medical records, which these records can be accessed by the healthcare team. Thus, it leaded rather to continuity of care, and it leaded also on the analysis when it comes to appropriateness of care management to the patient, because again, even the doctors are out of the hospital, they can still access information. Anyway, this could still consider the Data Privacy Act implementation, Privacy Act provisions that are being implemented here in the Philippines, because we need also to protect our data subjects who are our patients. And most of the authorized personnel who can just only view the information of the patient have been oriented by this law. So we have also discussed last time the three areas, the three involvement of the concepts in the health information technology, or HIT. This involved a multidisciplinary and interactive field. So integrative field rather. So we have utilized the computer as for the software and the hardware. The cognitive is the knowledge by which the nurses have acquired the necessary skills to manage this information and make a sound clinical decision making. And for the social sciences, we're talking about on how nurses efficiently collaborate with the healthcare team using the health information technologies. Now, we have discussed last time also the benefits of the health informatics because it improves patient care at the clinical level. Number two, we also considered improvement in the population because of the uh, geographical situations of situation rather of our country, wherein it limit the access to information. So I think this really consider po prevention aspect of our healthcare delivery system. And number three, it enabled the World Health Organization, the Department of Health, the United Nations, and even the Philippine Nurses Association that those data have been used on how to manage initiatives for the welfare of our patients. Now, our discussion for today is as we continue on the health informatics, again, I will invite everyone for the interactive discussion. The question for today for our interactive session is what healthcare settings uh, could consider topmost priority to establish health informatics? Is it in the clinical, referring to hospitals and specialty facility? Is it in the public health, wherein we consider rural health, rural and urban health centers, city health offices, or probably in nursing education, where schools and training facilities are being identified, or in government agencies such as Department of Health, Professional Regulation Commission, and other agencies that manages the healthcare delivery system of the country. Again, For everyone, please visit the slido.com with the code 3579619. Again, our question is, what healthcare settings where we can consider a priority, a topmost priority to establish health informatics, establish funding for technology infrastructure, uh, or funding that will prioritize establishment of information system. So in our real-time responses, we have among the respondents, we have 50% from the public health. Okay, so we have the same, or rather same results now between the public health and the government agencies. Now we have 44% for public health, government agencies 27%, and 17% for clinical and hospitals. A realization of the results of the survey that we have now for this question will open venue for all of us to explore and to share your reasons and explanation of why you have answered in any of the choices. There are no wrong answers in this survey. Thus, again, this survey is being conducted for us to have the basis for interactive discussion. So it seems we have almost 73% that goes with public health, 20% for the for the government agencies, and 7% for clinical. Please continue for the others who are not yet sending their responses. Anyway, for those who have responded, we have the records that will show your participation. So still we have 73%, 20%, and clinical. So I have seen a raised hand. Yes, Miss Kimberly Bakulat.
Dean, can I share po my thoughts
Sure,
regarding
sure, sure. Sure, yes. What about?
ano po kasi din, ang pinili ko po dito ay yung public health,
Mm-hmm.
rural and urban health center, city health offices. I do really think po na the public health really or should be the most priority to establish health informatics. Since nung nag-ano po kasi kami na community,
Mm-hmm.
nag-CHN po kami and nag-visit po kami ng community. Nakita ko po yung pangangailangan talaga ng community when it comes to this. Na since 'di ba nga po na i-discuss natin yung nagiging tulong ng
Mm-hmm.
health informatics sa mga hospitals na nagiging mas madali yung pagbibigay o yung pagpo-provide ng care, mas nagiging accessible siya. Sa tingin ko po na yung community din natin, it deserves as well that kind of care. Kasi po nung nag-visit kami sa community, ang dami po talaga yung iba hindi sila nakakapunta ng mga health centers kasi bukod sa hindi nila kaya financially, malayo or hindi sila aware doon sa kayang ibigay ng health center. So, I do really think na ano po, yung pagkakaroon ng health informatics in the community will magbibigay solution to those na to provide the community the care that they need or that they deserve. And ayun po din. Thank you po.
Very good sharing, Miss Kimberly. Your response is well appreciated on the extent that the in your observations, because you have visited the community, and I think your observations are very relevant. If you have observed the situations where some of the community constituents or people are not visiting health centers due to distance kasi they probably prioritize on taking care of the family members, or prioritize probably work. If the health centers are not accessible, then mainly they just uh, consider their own perception on how to manage their own health. But I think you have mentioned that when we establish health informatics, it will be easy for us. It will benefit definitely our patients, so that even the use of telemedicine and teleconsultation will really help our community. Other than that, probably you have mentioned about the services that may not reach the our constituents in the community. That is very true because even the profiling, if you will be asked in the community how many, for example, how many pregnant women are on high risk. So you need to, for example, if in one barangay, it do have 120 households. So it will really take time than just only 24 hours for you to gather all the information. While if you will establish a certain application that will be introduced and be oriented to the community, and basically it can already identify the symptoms, which mainly will consider them as high risk and will alert them to visit the rural or the urban health centers. So I think this will really help. This will definitely help our beneficiaries of care to be more independent, to be more confident in attending to their health. Yes, Miss Bakula, do you still have something to add on?
Yes po, Dean. Add ko lang po kasi nalimutan ko pong sabihin na 'di ba po sa UNICEF's po, one of our
Mm,
SDGs is good health and well-being. And
yeah.
I think po in order to achieve that, we really need to start small na if we want na ma-achieve or yung SDG po na yun, simulan po natin sa pinakamaliit na unit sa atin, which is the family, the community. And ayun lang po.
Yeah, correct. So, I think one thing that we really need to empower are the families. Okay, as mentioned nyo nga, it's the basic unit of the community. If the family members themselves cannot manage their own health, then it will affect the community. So simply on how, for example, if there are limitations on the extent of reach of those services, then we could use the informatics uh, or any application, even the Zoom platform on how we could do health education to our patients. And we are actually dealing not just only with sick individuals, we're also dealing with the well individuals wherein the objective is promotion of the health also. It's on the health maintenance. So that is definitely correct. Thank you, Ms. Bakulat, for sharing your insights and experiences. And now, Mr. Bonoan, our advocate of programs and initiatives for the community. Can I hear any sharing of experiences from you? Yes, Ferdinand Bonoan?
Yes, Dean. Hello po. Sorry, wait lang. Ubo lang ako. Mabilis lang po.
Go.
Okay na po. Wala po ang COVID. Nagtas po ako. So
It's
yun, I
okay.
have to agree po kay Kim, no? Very important po na yung pag-set up natin and ibigyan natin ng priority yung ating public health. No? Na-share nga po kanina ni Kim na yung as we go down po dun sa ating mga communities, as we go po dun sa grassroots communities natin, very apparent talaga na amid the current state of the country's economy po and mishandling of country's fund by the government, yung the Philippine healthcare pa din po has faced disastrous consequences pa din po, no. Unfortunately, many of the Filipinos pa din yung below the poverty line cannot afford to pay yung medical care that they need with the rising healthcare cost po. And many health workers have raised their alarm on unpaid benefit and insufficient health personnel po. And yun po, with these issues at hand po, I believe that healthcare is a fundamental right of every Filipino po. So maganda po na mas bigyan natin ng priority yung nasa ilalim, no, which is yung public healthcare. Very important pa din naman po yung mga government agencies such as DOH, PRC, DOST. Pero amidst the pandemic and still wala pa din tayong concrete plan for this kind of maganda talagang mas mag-devote tayo ng time, ng fund, ng energy dun sa public health kasi sila talaga yung nagsasuffer, no? Despite na nagbabayad sila ng tax na sinasabi natin. Pero at the end, parang sila pa din yung least na nabibigyan ng priority natin. So, yun nga po, with nung previous po, yung blockmates ko po, itong 2-1 po, kasama ko po sila sa pagbuo po ng Tanglaw ng Komunidad. So naging mahalaga po yung contribution ng bawat 2-1 po kasi lahat po sila nag-take part po dun sa initiative na yon, which is to go down po sa bawat barangay po. So yun po.
Thank you, Mr. Bunoan. Very impressive. That's why I even pushed you to still continue your advocacy, if it's either institutional or college-based, because I do firmly believe that with your advocacy, you focus primarily on the community-based initiative simply because you have observed the need for the prioritization of initiatives to empower our community people. And indeed, I truly agree. I truly agree and strongly agree with your perspective that we really need to prioritize the health centers and the city health offices, because the local government units are the ones that really be considered as the one that will primarily attend to these needs. And I think in the perspective of when we prioritize and consider allocation of funds for the in technological infrastructures and health informatics to the health center, I think it's the community that will also benefit. Kasi for example, if in one community we really wanted to identify the rollout of vaccination, so it will take time if you will really go, if you will really consider house to house visit. But if the health centers have already established a platform or had been advanced in their measures on how the community people will report those data, then I think it could really help our nurse to have the perspective or the whole picture on how it will still consider reporting. For example, okay, the vaccination rollout uh, for the age group, kasi ano pa lang yan eh, if it will consider the vaccination rollout, it is not just on the number that of vaccinated individuals, but we will also consider the population groups from children, elders, adults, because we need to analyze the data of why there is still there is still a problem with the increasing number of cases for elders in that community. Yun pala, decrease ang very low ang turnout of vaccination for the elders. So I think nowadays, the communities and even individuals do have their own gadgets, regardless of the unit. These are the means, these are powerful means for you to establish and to envision how you will use now this technology. All of us, every individual really do have their own cellular phones. So why not have this advocacy in the future to have these platforms or application that will really help? One example that I have mentioned to you is how you will reach those pregnant mothers who are high risk. Kasi Filipino mentality, if a pregnant individual will not experience any untoward symptoms, she will not definitely have her regular consultation, and yet she is unconscious that she is already on the high risk status of her pregnancy. So yun pa eh, tayo we will wait pa for the symptoms for us to be alert with the situation. But moreover, if we will try to design, to create an application that can already be downloaded in our own mobile phones, and the data translation and reach will be efficient, then the nurse could be more motivated on how to efficiently implement those data, use those data and implement a program. Kasi kung for example nga, mababa yung turnout, then we will strengthen the vaccination rollout for elders. So that's why it has the implication and relationship na why yung highly vulnerable individuals pa ang nataas ang cases of COVID. We can now connect ourselves to the present situation of public health. So that is the challenge for the second year. Try to think of the concept of any advancement that you can contribute to the community and will benefit the community. Since most of the answers here are already 78%, so probably you have observed this in your own communities, in your own health centers, or even during your immersion when you are implementing your advocacies, so you are aware of those issues and challenges. So I think you may contribute one uh, in your capacity by which it is doable. I know for a fact that you are more skilled now in your immersion and exposure and the use of the technology. Another is, if you will try to analyze in every disaster and calamities that we experience in the community, why there is still number of families that are affected, why there is still individuals who leaded into mortality, because they have not been reached by the services, by the information campaigns. So why not, for example, since every individual has the mobile, so manage to consider for free naman ang YouTube, then have this platform be a venue for you to share this to the community. If you try to share the link itself can be accessed by every individual. So you have contributed to health education. So other than that, we could also consider and tap them to the emergency contact numbers where they could access to NDRRMO or Philippine Red Cross. So just for example, you have experienced an emergency situation during disaster. When there are applications that you can download in your mobile phones. Once you download it and have the location, so yung principle lang yung principle na parang Grab na naghahanap ka ng Grab car. So pag dito for situations when a person or individual in the community will attend to an emergency, you will just have those applications and identify the nearest responders that may attend to you. That even kung malayo-layo ng konti and those individuals are near to your place, they could already contact you or you can already contact them so that you will be guided on what you will do even though in the absence pa of the responder. So I think that could really help if you could form a team of volunteers. For example, kayo tuwan, kunyari responders kayo in your own communities. Kung halimbawa ang isang area will consider tracking of responders during emergency, they could identify who's the nearest. Parang Grab lang di ba? Kapag nag-track ka for a Grab car, yung nearest kung sino yung tumanggap for you for this Grab car to respond, sila yung lalapit sa iyo, sila yung magre-respond sa iyo. So those are the pag-aralan niyo yung mga ganitong mga applications na kung paano how you will really help the community. And I think this could be very relevant at pag translate ito, we could present this to DOST, we could present this to the DOH, we could present this to the national government agencies so that it could be adopted. So I think the reach that you can do is, since you have at your level the capacity to design this platform, so this will definitely benefit our people, even your own families as well. So I know another issues that we encountered during the COVID-19 pandemic. During the pandemic, we have encountered problems sa what hospital can consider admissions because most of the hospitals have the full capacity. The DOH have introduced the one hospital command. The one hospital command is an application wherein it will identify if those hospital nearest to you are in full capacity. So if you will try to click those applications, it will identify the hospitals present nearest to your area, and it will already identify full capacity. Then you identify it did not reach pa the full capacity or maximum capacity. So doon ka na pupunta. The problem is that kung halimbawa emergency situation, pupunta ka nga doon sa nearest, you can't be admitted because of the full capacity. Then you go to the other hospital and it's full capacity, you cannot be admitted. At least with those applications, the time itself is very important. So you go straight already to that hospital that can accommodate you for emergency situations. So I think explore on those explore on those ideas now that will consider designing an application or anything that will really help the community if we are considering that in your responses 78%. So we have 17%. So we have two of our students here who have shared their insights. So let us, maybe we call others also to share, or anyone also who want to share their explanation on the answer. Can I call on Catherine, Miss Buenaventura?
Hello po,
Could
Dean.
yes,
Good evening po.
what is your response among those choices? We don't have the wrong answers here, but basically, you can all elaborate what response you have considered.
Same din po yung pinili ko din sa kanila, which is yung public health po.
Yeah.
Agree rin po ako sa sinabi nila kasi yun nga po, during yung community outreach po is, yun nga po, napansin ko rin po na marami pa ring mga mamamayan natin na hindi po aware sa mga ah, mga services na kayang ibigay ng ating health center. So, I
Mm-mm.
think ayun po, mas kailangan natin muna nga pong magsimula sa maliit, which is sa ating community para po
Yeah.
mas maging informed tayong lahat. Ayun po.
Yeah. So before we proceed with Miss Sophia, you are correct with your sharing. Kasi if, for example if you will try to visit visit those health centers, manual, there is still they still have manual measures to retrieve the file of patients. And it really take time. If, for example, you rather a pediatric client goes to the health center and you will track the immunization history, you still need to proceed to the records with the filing cabinet and retrieve those index cards index cards where the records have been documented. So it took time. So that's why there are long queues in health centers. Unlike if you will just track it through an information system that can be established in the health center. So I think it could be efficient to manage time, and it could be efficient to attend these patients accordingly with their needs. So thank you very much, Miss Buenaventura. So we'll now proceed to Miss Sophia Anos. Yes, Miss Anos.
Good evening po din.
Good
Same
evening.
answer lang din po with them na public health po. Kasi nung nag-community duty din po kami, nakita po namin na yung public health is, although meron pong mga projects and existing po silang programs for the community, pero hindi po totally aware yung community. Just
Yeah.
like with my client po,
Mhm.
meron po kasi siyang high blood. Pero yung reneseta po sa kanya nung doctor niya is hindi niya po tinitake, pinalitan niya po. Losartan po ata yun, but
Mhm.
pero pinalitan niya po since mahal daw po.
Mhm.
Then sinabi po namin na kung try po nila sa health center, pero hindi po pala sila aware na pwede silang makapag-avail ng medicine nila sa health center. And I think din po na with the help of other government agencies po, mas maayos po yung public health natin. Kasi meron po tayong thinking na when it comes to public health, lagi na lang pong DOH. Yung, may kakayahan na makatulong sa mga tao. Pero naniniwala po ako na we have to collaborate with other government agencies to do the work po. And it takes a lot of a whole government approach. Kasi ito po yung isa sa pinaka-hurdle na meron tayo. As to why yung public health natin ganito pa rin. Madami pong inequalities kasi hindi po lahat nagtatry to participate po. Marami pong programs na meron yung DOH pero hindi po lahat na-address. I think po sa yung mga different, we have to take into account yung kailangan ng different sectors natin
Yeah.
and to prioritize po yung basic needs po talaga. Marami pong gustong mangyari pero nakakalimutan po natin yung basic needs ng community.
Correct.
Yun.
Correct. Thank you so much. Since you have mentioned about Department of Health, the initiatives and programs are already in place. All of the, I think, city health offices are already oriented on these programs. But the problem is, do these programs have reached the grassroots? That's definitely the problem. Aside from the concern that we lack nurses, ha? We lack nurses. And I always say this in most of my interviews, that we really lack nurses in the grassroots. In the implementation of the universal healthcare, it reiterated that one nurse is to every barangay. Pero kung ang barangay naman, ang population niya ay almost 1,000 plus, and one nurse is managing it. So I think it could be more efficient to manage health in collaboration with the healthcare team. Kung isang nurse ka lang into each barangay pero 1,000 plus ang population. So I think it is more relevant to have this health informatics, because for sure a nurse may not even in 1 week can reach all these 1,000 plus families or households. So I think thank you for those sharing, Miss Anos. So I see a raised hand. Yes, Mr. Bonoan, do you have an addition to that?
Yes, Dean. Yun po, aside po dun sa public health, I just want to commend din po si Sophia po dun po sa pag-raise po nung sa government agencies. That's true po, no? Isa po sa nagiging problem natin at palagi po nating sinasabi is bakit ang liit ng budget, or like bakit insufficient yung budget na nare-receive ng DOH. So maganda din po na aside po sa dagdagan yung budget ng DOH, maganda din po yung collaboration between each government agencies, no? Kasi all these agencies po are also ensuring well-being for all the people naman po despite social class and financial capability po. So hindi lang naman po talaga DOH. So maganda po yung collaboration between government agencies. If hindi po natin kasi maayos itong delegation of tasks and then yung cooperation ng bawat government agencies, hindi din po talaga natin masusolusyonan lahat ng problema sa babae, no? Sa grassroots, no? So, yun po, mahalaga din po talaga yung government agencies po natin.
Thank you so much, Mr. Bonoan. I agree with your insight that we really need to establish a strong network to really establish implementation of universal healthcare, alignment to sustainable development goals. Kasi we need to be data driven as well. Kasi if, for example, we have a concern related to why there's an outbreak in that community, so how the nurse will respond. And if you do not have any information on hand using any informatics information system that has been established in that area. So it's because one of the gaps is probably a problem with the network. The DOH has the fund, but it's not implemented in the not it does not reach the community because the manner of reporting may not be effective, because for example, in a Parplang area, in geographically isolated, disadvantaged area, how can a nurse can have a timely submission of reports, and yet they do not have any established connectivity, or rather a platform that will do the reporting to the city health office, so that to attend the funding of the initiative, even though it is funded by the Department of Health. So I think there must be a continuous strong network relationship, and that will insert or integrate the concepts and principles of health informatics. In the government agencies, so we acknowledge the 11% responses. This is probably to consider probably those 11% that we have for government agencies to have this is also important to establish in these agencies kasi to facilitate efficient processing of data. Kasi these are agencies which we expect that they will provide data for us to benefit on the promotion and prevention of health, or even maximize the curative and rehabilitative pace of care management and facilities. For the hospital, I think we have the DOH that really prioritize informatics in the clinical hospitals. But if you will observe, not all government institutions have established infrastructure. That's why still there are delays of the services that are being given by the hospital. Or a typical example, most of the hospitals may lack, rather, are experiencing scarcity of resources. Or why it leaded to that perspective that there's already a scarce of those resources? It's because it is not being monitored. There are no mechanisms of monitoring, timely monitoring of the stocks and inventory of supplies. So if there is already an established information infrastructure or system in that hospital, it could monitor that the analysis that you really need to reserve stocks, because it will continue. For example, dengue hemorrhagic fever usually rise its number of cases every June. So expect that the hospital must also take into consideration the timely inventory of the supplies in relation to blood transfusion. So if come a time by June that they lack these supplies, it may also delay the administration of the blood to those who may need it in the case of dengue hemorrhagic fever. So can you see now the connection of how the health informatics will really help the operations of the hospital and how the nurse will attend to these needs? So in nursing education, so we don't have responses. Kasi I know for sure that you may respond to this. O bakit there are no, it's not a priority. It may be a priority, but not the topmost priority, because the schools have already established the various platforms to have the delivery of instruction. It's either face-to-face classes or blended learning. So that's why we can still conduct the delivery of instruction through online. So, but it will still continue to improve the infrastructure for those schools of nursing, because if it may come a time again, are those schools ready again for if ever there are public health emergencies that may not interrupt the delivery of instruction? That's another question. If there are no, probably since it is not highly prioritized and there are no budget, then these are the concerns and challenges that may be experienced by the nursing schools or training facilities. So probably we may call another one for the insights or sharing or on your responses. May I call on Miss may I call on Andre Lance Andre Brasino. Lance Andre, or probably he may have a problem with the connectivity. So next we may have Kevin, Mr. Kevin Buzon.
Hello po din.
Yes, Kevin, what is your response in this question in our survey?
Ano rin po, public health din po. Kasi po,
Oh,
para sa halos lahat po na kaninang nag-pick po ng public health, nag-agree din po ako kasi same din po na experience po namin nung nag-community duty po kami. Mas kailangan po talagang, para sa akin po, priority to establish health informatics po sa public health. Kasi po yung health center po doon sa napuntahan po namin barangay is maliit po. Tapos po yung ang dami pong tao, sobrang dami po ng tao para sa ganun kaliit na
facility.
health center. And ano po, mayroon din po ako nakakausap po doon ng mga citizen po doon na hindi po nila alam na sa health center po pala may ganitong service, tas yung gamot nga po na pwede po sila makapag-avail doon na mas mura. Yun po.
Thank you for those observations. It is really true that with your immersion in the community and you have talked with these people, those are the expected recipients of care, but somehow they have some dissatisfactions or some concerns which have not reached the authorities. So I think I know, and I felt now that the N21 will have an advocacy for this. So hoping in the future, again, as what I have mentioned, you will continue your advocacy for community health, and sooner or later will immerse you more in communities, just like what we are planning for our fourth-year students. They will be immersed into GDAS, the geographically isolated disadvantaged areas in Ilocos, so that for them to appreciate more on how they will contribute in public health, because this is in relation to the alignment of sustainable development goals, and the other one is on the alignment of the implementation of universal health care. And just this morning, we've also discussed on how our students will also be immersed into the international setting. That's why we are already programming your community immersion in our partner schools in Indonesia, so that in the level of yung analysis natin on how you will contribute in the global setting, this could be one. So that's why hoping, let us pray for this implementation. We are working on this matter, but in our Ilocos, it has been it has been accepted by the municipality, because our city health officer there is our alumni, and alumnus there. One of the public health nurse there is our alumnus. So that's why it could be the their experience in Ilocos for our graduating students will be more meaningful, because they will have a long period of time that they will be immersed in a community which is geographically isolated, disadvantaged areas. So for now, in your level, you are being immersed primarily in those health centers, and we are looking for other health centers which where you will be immersed, such as yung may tatawag tayong mga super health center. Kung bakit sa super health center or high-end health centers, because it is operating for 24 hours, and it has also allying in services for birthing, as birthing facility. So these are the ways on how we consider the importance of health informatics and your immersion in the community. So continue this mindset, continue this mindset on how we will still help our people as future professionals. You will be part of the implementation of the universal healthcare. So thank you so much for your responses. Now we will continue on the perspective of the how nurses continue to take their role into different settings and across the lifespan. The concepts and difference between nursing informatics and clinical informatics is that when we say nursing informatics, obviously nurses, okay, nurses as the human resources for health are dealing with their tasks, are dealing with their tasks using technology. We all know that nurses are the ones who have high percentage of interaction with patients. Moreover, we're expected to do more documentations. And indeed, the use of the information technology and the hospital information system or any platforms applicable to the healthcare setting will consider number one, for sure, we do patient care recording or management records through charting or through physical examinations or rather care management plans or nursing care plans. This could be integrated in the nursing informatics, because our each of our role and function will be aligned on the use of technology. So as with the documentation on the legal perspective, we are also protected and we're also advocating for patients' welfare, which is safety. So the clinical informatics, these are the information being provided to the caregivers. The caregivers are the ones are the ones that are identified with the healthcare team. Okay, so in general, it's not the caregivers that we used to know. The caregivers that we are emphasizing here is the healthcare team. So, ang difference with the nursing informatics, nurses are more focused on their functions and aligned it with technology. Okay, which is more on the patient care and documentation. While on the clinical informatics, the information that can be accessed by the healthcare team, doctors, nurses, pharmacists. So in a hospital operation, clinical informatics matters because the core stakeholder, the stakeholders that we consider in most of the hospitals and healthcare facilities are patients, well or sick individuals. But with the shared information among the healthcare team, it's clinical informatics. Again, if you have any questions, any clarifications, you may just raise your hand or post it in our chat box. But for now, I am not seeing any raised hand or any questions in the chat box. Let us continue. Another is that of in every hospital, it is recommended that there must be chief nursing information officer and chief medical, that's information officer. So since the chief nursing information officer will what could be the expected competencies that she may have? Probably she has the clinical experience, and other than that, she has also an experience and competence and even expertise in information technology. It is on how a nurse function accordingly and link it with the use of technology. With the various processes that we have been involved, from assessment, from planning, intervention, evaluation, feedback, and even the operation of the hospital as a business, the Chief Nursing Information Officer takes charge of all these processes as well, involving nurses. While the Chief Medical Information Officers are the ones wherein she or he considered her task on monitoring the use of the technology in a perspective of the maximization and utilization of the healthcare team. So that's why we have considered clinical informatics. So in clinical informatics, there is a chief medical information officer because he takes charge of monitoring of the use of the information system platform that could be maximized by healthcare personnel and non-healthcare personnel. While in nursing and informatics, we focus on nurses with their tasks and maximize the use of technology. And who heads and monitor those functions or those initiatives that will really help our nurses in these operations is the Chief Nursing Information Officer. Now let us now proceed the difference between the nursing service and the medical. Okay, so we just continue with the discussion and consistently with the first definition that we have for nursing informatics and clinical informatics, and with the role of the chief nursing officer and the chief medical information officer. In the nursing service, I have mentioned to you the functions of nurses and what are those processes that can apply technology. So when a nurse records, kasi we are aware, and I know you are oriented that when the nurse manually records documents in a chart, that's manual. But if the nurse maximizes the use of electronic health records, electronic medical records, and have her entries using this platform through tick to those findings and assessment, you are using the information technology products by which, if you are aware of Bitsbox, these are the usual company that being catered by those hospital nowadays in the hospital information system. So if we will ask the healthcare personnel in the hospital who can effectively gives the feedback, moreover, we are nurses in 24 hours are doing the interaction with the patients and doing the recording to the patients because we prioritize their safety. So all the records are being stored in that system and can be retrieved by those authorized healthcare personnel for purposes of treatment regimen or pharmacological management. While on the medical, since it involves the non-healthcare personnel and the healthcare personnel, it is on how it can measure naman yung holistic approach on a day-to-day patient care. So that is more on the medical. Okay, next. When we consider the point that a nurse will consider career. Yan. Sir, what are those basic requirements? What are those opportunities? What are those competencies that we may need if we want to be a nurse informaticist? Sir, question, do we have here already a program that will gear towards our specialization nowadays? Being immersed into the comprehensive nursing bill, it is in our bill to have the advanced practice nursing. Sooner or later, if this will pursue in our comprehensive nursing bill, we will recognize those nurses who have already the expertise in technology and at the same time in informatics and at the same time as nurses. So nurse informaticists. So they may have officially this title and you will be certified. So I think on the perspective of opportunities and competencies on a frontline, middle, or probably on administrative level. I will be presenting to you a video presentation that had been retrieved as a disclaimer to University of Texas, and what are those educational programs that they are offering related to an interest of a nurse to be in health informatics or nursing informatics. Let's watch this.
Today we are here to talk about the exciting opportunities in the field of health informatics, otherwise known as HI. You may be more familiar with the name medical records. In the past, medical records consisted of handwritten notes, x-ray and laboratory reports, and other information, all documented on paper and put together into one file, which was then put into large rooms. Whenever the need arose to review the records of a specific patient, the patient's file would be retrieved from the filing room and delivered to the requesting physician or clinician. Today, the U.S. healthcare industry is trying to implement health information technology for all providers and related businesses. This requires a new workforce with specific training in health information technology. So, what specifically is health informatics? HI is the application of information processing involving both the computer hardware and software. It deals with the storage, retrieval, sharing, and use of healthcare information, data, and knowledge, including its communication and for decision-making. Nothing in healthcare occurs without the information. For example, when we go to the doctor or the hospital, they take down certain information, such as height, weight, or blood pressure. This information often includes diagnoses of conditions we may have, as well as lab results and prescription medications. A term you might hear when people are talking about health informatics is the electronic health record, or EHR. The EHR is a real-time patient health record with access to tools that can be used to aid clinicians in decision-making using the most current knowledge available. The EHR can automate and streamline a clinician's workflow, ensuring that all clinical information is communicated when and where it is needed. So, where do health informatics employees work? They work in a variety of settings, including hospitals, ambulatory care clinics, private physician practices such as your doctor's office, skilled nursing facilities, and military MVA facilities. They also work for EHR vendors in which they help to develop, program, sell, and implement the various EHR products. Or they can work in higher education, meaning in universities and community colleges, as educators, researchers, and innovators of health informatics. What kinds of roles do health informatics workers fill? Again, many different ones. For example, at the entry level, one can choose to become an HIM clerk or medical records specialist, in which one primarily works with the patient records. Typically, the education level necessary for an entry-level role is a 2-year or associate's degree. Or they can choose an intermediate role, including supervisor or manager, data analyst, or implementation specialist. A data analyst uses statistical techniques to rearrange health information into patterns and categories that can be useful for many different purposes. An implementation specialist is someone who installs hardware or software for the healthcare organization. Usually, in order to be in an intermediate role, you need a 4-year or bachelor's degree and applicable work experience. There are even advanced career levels on the HI pathway. Some of these include a quality director, who is responsible for ensuring the organization is meeting its patient care quality goals, or a chief information officer or CIO, leading the IT investment and implementation strategies, or a chief knowledge officer, CKO, someone who is responsible for converting data into knowledge the organization can use. Someone at this level has a bachelor's or master's degree with lots of work experience. These people really are the experts. What kinds of skills do you need for these roles? There are different categories of necessary skills, such as technical, workplace, academic, and personal effectiveness skills. For example, a technical skill would be to have some knowledge of medical terminology, to know the language of medicine and related words. Have you ever heard a doctor read your blood pressure? Usually they say something like 120/80, and you think, what does that mean? Learning medical terminology would help. It is important to keep health information private and secure. This requires the knowledge of the applicable laws and regulations. What about workplace skills? They are also necessary. Collaborating or being able to work with others is critical when you are assigned to a team and you need to finish the project together. Knowing what the different HI products do and how they can be used most effectively in a variety of settings is also vital for HIT workers. Academic skills are also important. You must be able to read and understand assignments, memos, and other deliverables given to you from your supervisors. You must also be able to write clearly and concisely, as well as think innovatively in order to produce results. Personal effectiveness skills are important. This means being able to work together as a team, effectively communicating, showing up to work on time, and proving you are dependable. And you must also be able to demonstrate adaptability during assignments or projects. So what type of education is available in Texas for health informatics? There are 2 Bachelor's of Health Information Management degree programs available in Texas. One is available at Texas State University in San Marcos and the other at Texas Southern University in Houston. Both offer campus classes where the students enter as a junior, having already completed their Texas required core classes. Texas State also offers its classes in an online format. The 4+1 program is a dual program between UT Health and other four-year universities. It is open to students pursuing an undergraduate degree in biomedical sciences, biology, nursing, mathematics, and computer science. While enrolled, the 4+1 program students will take 5 courses with the School of Biomedical Informatics that will constitute a graduate certificate in health informatics. At the conclusion of their undergraduate degree, students will have obtained both their bachelor's and the graduate certificate. Those students who wish to continue on to their master's degree will have only an additional year of classes instead of 2 years to complete a master's degree. The master's and doctoral degree programs are both available from the University of Texas Health Science Center School of Biomedical Informatics at Houston. We offer a Master's of Science in Health Informatics with a traditional and applied track and a Doctor of Philosophy degree in Health Informatics. For additional information regarding our academic programs, visit our website at sb.
Okay. Eventually, those programs are being offered abroad. The next question that you probably may ask, are these programs already established here in the Philippines? There are a few schools that are already offering a master's in the health informatics. We have University of the Philippines, Open University, De La Salle University, Asian Institute of Management. So hoping soon we could also establish that the direction na even if you are in the bachelor's degree, you could already have the subspecialization when it comes to higher percentage of the intensive practicum if you are interested in healthcare informatics. That could be possible, and it is part of our direction in MCU, College of Nursing. So for the healthcare informatics, let us put it to the perspective the benefits. So I think we may not anymore have the health break because this is just the last 3 slides that we have, so that you can still have the 15 minutes as it opened the 7:30 to 8:30 self-assessment exercises. Those are only 10 items that the coverage is within the topics that we have discussed from the past until today. Now, healthcare informatics as a potential method. If we consider it as a potential method, meaning um, this will this will really help when it comes to real-time clinical decision making. Just like what I have set as an example, that when an emergency room nurse attends to an emergency case in the emergency, obviously it's in the emergency room, and definitely an emergency case, and the doctor, the attending physician, is still not within the vicinity of the hospital. So the nurse will inform the concerned attending physician of the patient's present condition, but somehow there are some situations even before that they will call the doctor of the so that the doctor will be well informed of the situation of the client. But there are some situations when the doctor is still on the driving, it could not be safe. But somehow, some hospitals have established the information system wherein it can already access all the information that had been entered by the nurse. Kasi there are the possibility by call, there could be chances of committing errors. It's either misheard, if it's choppy, the nurse may misheard the orders of the doctor, or the doctor, on the other hand, may miss the complete information that the nurse intend to address to the doctor. So that's why for the hospital who have already the hospital information system, the nurse will just enter all those physical examination findings, signs and symptoms, results of diagnostic examinations. Then the doctor will enter also her or his treatment regimen. And that could be documented as well. So it also protect on it can also mitigate errors because the doctors directly uh, uh, entered his treatment regimen in the hospital information system, because it is very important to have the real-time decision making, because as what I have mentioned, this will cause the possibility of either it may time is really an important element in managing emergency situations. That's why it need to prevent these situations or any complications if we have a timely administration of the intervention and the treatment regimen. So in this perspective, this may provide the real-time information, and at least it could have also a real-time concern with direct patient care. So other than that, as a potential method, it can consider minimizing errors. As what I have said, in the audio, also in the audio-visual presentation, the emphasis of the use of the electronic health records. So these are the following computerized functions. So we have been aware of how the doctor, how the information will be protected. So nowadays, di ba, it cannot access the passcode kasi barcoding na siya. And that is customized for every individual. That's why if, for example, a nurse wish to know the electronic health records of the patient, it is just only the barcode itself and may access the site. And if you are authorized and given the viewing rights, then you can access with those information. So very easy, right? So we have also the electronic health records on the medication reconciliation. This will identify the reconciliation of the dispensed drug by the pharmacist and the doctor's order, the stocks that are already available, and the nurse when it comes to the time of administration to the patient. And if there are manifestations of adverse reactions. So anything that's related to medication administration, it can minimize or rather prevent errors because it can already manage the real-time checking of those healthcare personnel who may have the viewing rights. Next, it's on the healthcare provider order entry. So this is pertain on how the doctor and the nurse have the relationship in carrying out orders. As what I have mentioned, each healthcare personnel may also have the code, and this code may not significantly indirectly. For example, you miss to what do you call this, to log out in the hospital information system. So you are also being protected, and the doctors and even the patient will be protected because it just only use code. So it could be barcoding, or it can only use a specific code that had been institutionalized. So still, we are abiding a good abiding citizens when it comes to the implementation of the Data Privacy Act. So patient care alerts and reminders. Again, I know some of you have those advancement with the use of the gadgets. Kaya, di ba, may mga built-in programs na yan sa mga digital watches. Pagka, if the patient is decreasing oxygen saturation and it may trigger chest pain, it will alert. It will really alert the patient. There are microchips that could be installed into this gadget so that it will facilitate alarm or reminders to those patients, and may seek medical help or attention nearest to the nearest hospital or facility. Another is the patient care alerts or reminders are a typical applications that are applicable for the elders. Kasi di ba before, most of the elders are admitted into the home care facilities, but some of the elders do not want, but they have those medication regimens or treatments as well. So for reminders, it may alarm the specific application that you will take the drug, how many, and the nurse can monitor if the patient already took the drug. But there could be also an application that once the patient will be alerted, the nurse will have the video call so that to check if the drug is correct, the dose is correct, and if the patient took the drug in the right route or correct route. So these are advancements, and it will minimize errors even in not in a physical mode. However, we have been oriented caring as touching lives, as having the physical interactions with the patient. We still consider those values. However, we must also be flexible whenever there are situations that may need to embrace this technology. Okay, so the last slide is focused on how it will promote meaningful use of electronic health records. If we say meaningful, we could also say useful, right? So it can already facilitate quality healthcare through electronic exchange of health information. A typical example, meaningful use. A patient who have her almost a prenatal consultation in the province, but she was admitted in the hospital in National Capital Region, and here comes the doctor. Rather, here comes the patient who is in severe labor pain and cannot manage any more responses to the doctors or to the questions of the doctor, and possibly the risk for that is the reliability with her condition, lalo na if the patient was given with narcotic analgesic. Oh, come on, these are really very risky on those critical questions that needed to be answered by the patients. So that's why the most important electronic exchange of health information, if, for example, the patient is or rather had her 8 months prenatal consultation in a clinic, so the hospital can just access, or rather will be given the viewing rights for purposes of medication history, of the consultation history, and even with the past medical history of the patient, so that this could be very useful on the present condition or situation of the patient. Lalo na, for example, if you will administer drug. Kasi if the patient is not capable, although the patient is coherent, but the patient is not anymore comfortable, is restless, and cannot respond to your questions. So what would be the alternative so that it will prevent specific errors to the patient? So merely, it can consider those aspects. If you will search on the if you will search on the RX box, this was the initial project of the Department of Health before to facilitate yung access sana ng information sa mga health centers, but it didn't materialize again. The concern is the budget. So that's the problem. Okay, now, we can also consider the engagement of patients and family members. This is on the perspective when the patient, ayan, di ba, when the patient will be discharged from the hospital, definitely nurses, doctors will not be with you at home. Now, to have the continuity of care, the patient can still access, can still extend, rather, the healthcare personnel can still extend services through the use of the platform for the monitoring of the patients themselves through the use of the platform. So I think these portals could be very useful. So similar situation that we have in the similar situations that we have in the higher education institutions or nursing schools, wherein a large group of student population can facilitate the use of the the neo LMS. So this could be also be cascaded, same or similar principles that can be considered for the can be considered for the large group of population in communities. Other than that, this meaningful use of health records can improve care coordination, and it will benefit the whole population. So I know we have already identified concerns in public health, the population groups, and I think this could be one way on how we will take charge in the future universal healthcare. And again, I challenge each one of you to really to start conceptualizing on the use of the technology and how it will help the community. So I think I will end up to this topic because this is the coverage of our topic for today. And since I have not even declared what do you call this, a health break, so seemingly you will maximize the 15 minutes break from 7:15 to 7:30, and at 7:30 our self-assessment exercise will be open. So I'll stop the recording.